Wuhan, China, the city where the first case of COVID-19 was detected. Since then, the virus has spread around the world. Sunday saw the highest number of cases reported in one day.
Certainly the numbers are increasing because the epidemic is developing in a number of populous countries at the same time and across the whole world. So from that perspective, a large number of countries are contributing to that overall increase. Some of that increase may be attributed to increased testing. Countries are testing more, and certainly countries like India are testing more. But we do not believe that this is a testing phenomenon. Clearly, when you look at hospital admissions are also rising in a number of countries, deaths are also rising, and they're not due to increased testing per se. So there definitely is a shift in the sense that the virus is now very well established at a global level. It has reached some of the most populous countries in the world, some of the most populated areas of the world, and because the epidemic is now peaking or moving towards a peak in a number of large countries at the same time, you're seeing that impact on the number of cases. Now, in Europe, in Western Europe, you're seeing the curves decrease. In Southeast Asia, you're seeing the curves decrease, and then the overall numbers increase, which clearly means the Americas are contributing, South Asia is contributing very much, but also there are countries in the Middle East and there are countries in Africa that are also contributing to that overall increase. So the situation is definitely accelerating in a number of countries with larger populations, and that is most certainly contributing to this overall increased number.
South Africa's health minister has also raised concern.
Already right now, the numbers of those who have succumbed are counting very close to 2,000. Those numbers will quickly start rising. They'll rise very quickly. The numbers of people, we're talking about the 97,000 today, but in a few weeks we'll be talking about several hundreds of thousands. And that actually is because of this behavior. This is what you are seeing now. Wait for 2 weeks. You will see the impact of how the recklessness that we would have actually seen now, how it will actually translate in the numbers of more new infections that are going to be coming. The real risk is when those numbers are so huge that even our hospitals can't cope.
With more sectors resuming operations, COVID-19 cases are expected to continue to rise. Sophie Mkhize, SABC News, Johannesburg.